Assalamu alaikum, everyone, and good evening. You are listening to The Health Show with me, Madeeha on Ramadan Radio, London 87.9 FM, online at ramadanradio.org, and on Facebook. Please call, text, WhatsApp feedback or any questions or comments on 077 614 60614. That's 077 614 60614 to do the health show, and today I'm going to be talking about cancer screening. So my title for this 30-minute segment is Catch Cancer, and I really want to draw on the importance of cancer screening, specifically the national screening campaigns that we have, which are bowel screening, breast screening and cervical screening. And the key points that I want everyone to take away from the chat today is that the GPs are available, the screening is going ahead, everything is being made as safe as it can in COVID, and that it's really important to get yourself informed about cancer screening and think about how it actually saves lives, how it can cause early diagnosis, and how that early diagnosis is crucial to long-term outcomes. So a slight disclaimer, I am a healthcare professional, but that doesn't mean that any advice given in this presentation can substitute direct tailored medical advice. Viewers should not message regarding personal healthcare problems, and they should see their registered doctor. Any concerns about any health problems, again, see your registered doctor. So with that, we shall begin. So as mentioned, I'm here today representing BIMA, so that is the British Islamic Medical Association. BIMA were founded in 2013, so we're coming up now 8 years in, and mashallah, we have grown. We've now got to around 4,000 members. And these 4,000 members are, alhamdulillah, doctors, pharmacists, research associates, dentists, optometrists, nurses, paramedics, students, and many, many more allied health professionals. We're a completely volunteer-led and volunteer-funded organisation, and we have a presence across all regions of the UK. And one of the things that I'm involved in BIMA is the grassroots work, which is getting out in the health promotion and speaking to people in mosques, community centres and on radio stations about things that are important to the health of the Islamic community here in the UK. So please do check out the britishima.org. That's our website, and check us out on Twitter, Facebook and on Instagram. And Instagram is british.ima, and everything else you can find us on British IMA. Lovely. So as mentioned, I will be talking about cancer screening, and cancer screening is a campaign that we have been doing since 2018 here at BIMA, and the importance of this really is just to start educating and talking about the information that's out there and dispelling the false information that exists. So there's quite shocking stats that talk about the national average of cancer screening campaigns against what we find in our local communities. So, for example, just to really highlight why it's important for us to have this conversation and actually start delving into perhaps the reasons why, I'll just go through these stats very 71.6%. These stats are pre-COVID, so they might be slightly skewed now, but looking at the uptake in, for example, Bradford, we've got an uptake of around 55% there. So you've got an almost like 22% difference. No, I've got my maths completely wrong. So you've got it from, so the national average is about 72%, and in Bradford, you've got an uptake of about 55%. So, there is a discrepancy there, a massive discrepancy in uptake. Tower Hamlets, you're looking at, again, similar rates, 54%. And in Birmingham, you've got rates of about 67.5%. For cervical cancer screening, the national average is about 72%. In Newham, the rates are about 62%, Luton 64%, and Bradford at 61%. So at least 10% difference in each of those regions. Bowel cancer screening. Now, this is where it gets even more shocking. So bowel cancer, early outcomes of bowel cancer is critical. So bowel cancer screening, national average is 60.5%. Then in Bradford, we've got rates of about 37%. In Tower Hamlets, we've got rates of about 42%. And in Leicester, you've got rates of about 45%. So in the case of Bradford, that's an over 20% difference. So yeah, that's why we're talking about this. There is a difference in our communities, and we need to really start thinking why. I mean, is it due to the fact that there are false or incorrect health beliefs out there? Could it be due to the fact that there's cultural barriers stopping people from wanting to take up the cancer screening due to perhaps privacy or shame or a feeling of discomfort? Is it due to a language barrier, people not realizing the importance of these and perhaps ignoring their letters and reminders? Is it due to a lack of education from the NHS about cancer screening and not enough targeted intervention into our communities? Or is it just because there's restricted access, for example, restricted access to healthcare, or even small things like transportation to be able to go and attend the cancer screening? So if anyone has any ideas, you can contact us at British IMA, and it just would be really good now for everyone to start thinking, do you attend your cancer screening? Do you tell your parents to check your cancer screening? Do you actually regard it as important? I mean, if we don't regard it as important, I think the biggest thing to really highlight is how important it is to survival. So when we think about cancer, it unfortunately is something that affects so many people nowadays. About 1 in 2 people are reported to be affected by cancer in their lives. So unfortunately, it's something we have to live with, and it's something that we have to start managing now. We have to start thinking about our lifestyle factors that can increase our risk, and we have to start thinking about what we can do to prevent that cancer and what we can do to. In terms of survival, it's well understood that if you basically find that cancer early at a lower stage, let's say stage 1, your survival outcomes are much, much greater. So you're in a much better position if you find that cancer early. If you find that cancer later, once it's spread, let's say perhaps once it gets to like the higher stages, like let's say stage 4, it's more difficult to control that cancer. So the survival outcomes, the treatment options are not as good. So it's really important for us to think about when we're thinking about cancer, okay, let's catch it early. And there's actually a story that I want to share. So it's always stuck in my mind, and it's always made me realize, oh, so that's how people see it. So I was trying to basically do a talk on cancer screening at my local mosque, and when I spoke to the lady who needed to basically organize that for me, her comment to me was, it's okay for you because you're young. It's not scary for you to talk about cancer. She's like, I wouldn't want to attend. I don't want to hear about it. She's like, it's better not to know. So she was very much of the viewpoint of, you just, pretend like there's nothing wrong and nothing will be wrong. But then I was like, no, that's not how it works. Your body is an amana. You are in charge of your health. You should manage it and you should look after it proactively. And actually, when we think about what cancer screening is, it isn't scary, because the whole design of the programs is to, not number one, just check. And so many people will go through the program and have, it doesn't mean that if you go through the program, you're going to get given a cancer diagnosis. And the second thing is, if you don't have any symptoms and you're not presenting to your doctor, how do you know what's going on? So by having these programs, you're actually finding something very early on. And the whole point is that it's actually going to save your life. So it's good news. So it's nothing to be worried about. It's not something scary, or it's not a taboo, or we have to start thinking that the doctor's going to give us bad news, or they're going to uncover some horribleness. No, it's, we take our, I don't want to, I guess I am going to, but I was going to say, if we compare, so when we think about our cars, we take our cars for our MOTs, our services, we check to see that everything is running smoothly. When it comes to us, and let's say standard health checks, and let's say screening programs, we're not so keen to embark on that. But like I said, your body is an amana, so it's your duty to be informed about what's happening and how to then manage that. So that was just an interesting perspective that I wanted to share, and how we can almost fool ourselves into thinking that by not going to the cancer screening, we're helping ourselves, when actually no, it's a complete counter argument. And again, like, let's use some stats to really back up what we're saying. So for breast cancer, if you find it at stage 1, you have a 100% chance of a 1-year survival. Amazing rates. But if you find that breast cancer at stage 4, so the more advanced cancer where it's spread and it's affecting other areas of the body, you're looking at a 1-year survival of about 66%, and a 5-year survival of about 26%. So yeah, I mean, those numbers are just screaming out, find me early, get me treated, get me sorted. Cervical cancer, you're looking at a 1-year survival of about 96% if you find it in stage 1, but again 50%, so massive drop if you find it at stage 4, and it gets even worse. 5-year survival for stage 4, if you find it at stage 4, is about 15%. Bowel cancer, 1-year survival if you find it at stage 1 is about 98%, and then that dramatically halves to about 44% if you find stage 4 cancer. And then even worse numbers, unfortunately, 5-year survival, stage 4 bowel cancer is about 10%. So this is all data from Cancer Research UK, and like I said, it might be slightly outdated, so please do just take that with a pinch of salt. It's just to highlight that, look, the numbers are there, we know it. Early intervention is key. And that's what screening is. Screening is a way of detecting the early signs of disease, and it's intended for all those people who don't have symptoms. So naturally, usually you would go to the GP once you have an issue. So let's say dramatic weight loss or bleeding where there shouldn't be, or you feel any bumps or lumps, and you'd go to the GP and you'd be like, I'm concerned, there's something there. By the time there's symptoms, we're usually looking further down the line. So stage 1, you wouldn't normally have any symptoms of cancer. So screening is pretty much your only real way of finding that cancer. And it's almost like a filter system. So everyone goes through the screening process, and the majority of people, and I mean, honestly, the vast, vast majority of people, tests will come back absolutely fine, nothing to worry about. A small percentage of that will have to go on and have further tests. So because the screen test is just there as a marker to see if there's anything to worry about, the further test will actually look deeply and see, okay, what's happening? Is it cancer? Is it something else? So from those further tests, again, not everyone's going to be diagnosed with cancer. From those further tests, it will be a percentage of those that would have a diagnosis, and hopefully a very early diagnosis. And some of those, I mean, there'll be no further action, or some just might need a bit of advice for support to change some dietary or lifestyle factors. But yeah, it's just to show that it's really, really, really integral to reduce the number of people that are dying from cancer. And the 2 ways that screening does this is, number 1, detecting the cancer early, that I know I've talked at length about. And number 2, actually, by preventing through your screening test, you can actually prevent the cancer. Okay, lovely. So as I mentioned in the introduction, there are 3 main screening programs in the UK. So we have bowel cancer screening, breast cancer screening, and cervical cancer screening. And it varies in terms of the demographic that are called for each of these. So I'll go through them one by one. Bowel cancer screening. So this is for both men and women. And nowadays it's done by something called a fecal immunochemical test, a FIT kit. And this is something that comes through your letterbox roughly every 2 years. It may be slightly delayed now because of COVID. But everything is up and running, and people are being invited now to take part in their bowel cancer screening. And basically, I'll go through to how to do the kit later, but it's 60 to 74-year-olds every 2 years. Then you've got breast cancer screening, which is for women, and that's for women aged about 50 to 70 years, and that's every 3 years. And once you're over the age of 70, you can request a mammogram. So the mammogram, again, I'll go into that later. Cervical cancer screening, this is covering a wider population because we're looking at women aged between 25 to 64 years that are invited every 3 years, and then after that every 5 years from the age of 50 to 64. Lovely. So yeah, 3 main programs: bowel cancer screening for everyone, breast cancer screening for women, and cervical cancer screening for women. And once you get over the actual requirements for, once you get over the cohort that the government invites you to every year, you can actually request it from your GP. So it's not a case that it's only within those age frames that you can have the screening programs. So bowel cancer is one of the most common cancers. It's reported as the fourth most common cancer at the moment in the UK. And I mean, this data is from 2014 to 2016, but that data shows there's about 44 deaths every day from bowel cancer. And I mean, 50% of bowel cancer cases are linked to modifier risk factors such as better intake of fiber, reducing processed food, reducing processed meats. So that's something to definitely think about, especially now in the month of Ramadan, where Ramadan is a beautiful, beautiful month for us to consider how we treat our body, what we put into our body, how we are using food for fuel, and basically think about, what are your food choices that you're making, and is it helping you? Are you treating your body well? And what are the effects of the perhaps not so good things that you're eating? So, symptoms that people might actually present to changing the bowel habit. So that means maybe going to the toilet more often, noticing that you're getting looser poos or constipation, lumps in the back passage, a pain in the tummy or bottom, needing to strain when you go, unexplained weight loss, and then tiredness and breathlessness. So if you have any of the symptoms that I've just listed, you don't wait to be screened. That's an example of going to see your GP. And again, I was talking to somebody recently who had a few of these symptoms and was refusing to go to the GP for fear of COVID. I mean, I can't stress now how important it is for us to start getting access to health services again and speaking to your GP when you need to. And these things, what we call red flags, you definitely need to speak to your GP. These aren't things to basically wait. Go to GP if you ever have any concerns. So one of the things again, I was part of the cancer screenings in the mosque. I was talking to a sister, and she was like, "Oh my gosh, I'm not going to make my father-in-law do the fit kit. It's disgusting. How am I going to explain it to him?" And I was like, "Look, okay." When it comes to health, like alhamdulillah, we should feel brave to talk about these things. And I was like, I'm sure he will appreciate you being open and honest and candid. And it's not something for us to be ashamed about at the end of the day. I mean, the fit kit, what it basically does is it asks you to send a sample of your feces. So the way that you would collect that sample is you would basically perhaps put like a tub in the toilet and put some folded tissue paper on there, and then you would basically collect a sample of feces. Then you basically get a stick and you put that into the feces until like there's 2 dots that are on there that are covered, and then you close that in a tube and you send it off in the post. And the reason for that test is to basically detect a very early sign, which is blood in your feces. And that blood in the feces may not be due to cancer, it may be due to something as simple as hemorrhoids, but the idea is that you want to again filter out the people who have that symptom and those who don't. So it's very important that we do start having these conversations and we start removing that stigma. Yes, because it's for our health, it's for our betterment. We're not talking about it for no good reason. We're talking about it for the best reason that there is. So yes, men and women aged 60 to 74 every 2 years. And something that we need to really highlight here is you have to register with a GP. So please make sure if you haven't registered with a GP that you do. Okay, and just to clear, if you did have any things, if you did have, for example, blood in the poo, you'd be sent for further tests. It would not there and then you would not be diagnosed with bowel cancer. Okay. And rough have an abnormal result, and then of those 2 people, 50% have absolutely nothing abnormal detected. 40% have something called polyps that can actually be rectified and prevent cancer in the future, and then 10 of that 2%, so 0.2% of that original 100, are diagnosed with cancer, and hopefully, again, very early stage, that's treatable. So again, really key message is there to save lives, okay? So we do have to touch on the harms, because there's 2 sides to every story, and I really feel that we should be informed when we make our decisions about our health. We have to show the full spectrum. So Sometimes you can get a false positive result, but again, that's rare. Sometimes you can miss the cancer and you can get a false negative result, but again, that's rare. Some people might start getting false reassurances from a normal result, and then if they do experience symptoms later, they might not report that. So bear in mind that there and then when you had the test, nothing was detected, or perhaps it was missed. And so if you ever do have symptoms, always go to your GP. And sometimes bowel, like a polyp or a bowel cancer that might not have caused any harm, is diagnosed and treated. We refer to that as overdiagnosis or treatment. Again, very rare. And the tests themselves like have risks such as bleeding, but that's not so common, and very, very, at the end of the day, these are all things that are, every procedure has a side effect, and you have to take that and think about that risk against the massive overall benefit that is saving lives. Okay. So I have only got about 10 minutes to quickly talk about cervical cancer screening and breast cancer screening. So I shall be very, very quick. And just before I do go on to them, I do really want to stress that when it comes to our cancer screening programs in the UK and coronavirus, alhamdulillah, we can say that things are back to normal. Okay, so the GPs are open, they're willing to see people, and they are safe. So people will be wearing extra protection, extra protective clothing, and you might need to perhaps wear a mask, and they will obviously also have their protective clothing. So please don't be concerned about COVID-19. Even if you're self-isolating, do attend your appointments, do talk to your doctor if you are concerned. Okay. Now let's quickly just do a whistle-stop tour of cervical cancer and then breast cancer. So cervix is the lower part of our womb, and if the cells there grow uncontrollably, that basically can lead to a life-threatening tumour. It's not as common as bowel cancer, but we still have around 852 deaths per year from cervical cancer, and most of those cancers are caused by something called HPV infection. Okay. So HPV is the major risk factor, and it's linked to 99.8% of cervical cancers. And other factors might be like smoking, HIV, use of oral contraceptives, but that's a very, very low incidence compared to HPV. So HPV is a human papillomavirus, and it's a very, very common infection, and about 80% of people are going to come into contact with HPV during their lifetime. And for most people, you would just clear the infection by your natural immune system, and no problems. There is actually a vaccination out in the UK against HPV called Gardasil, and basically so now, it's rolled out across schools that girls aged between 11 to 13 have been offered the vaccination, but it doesn't protect against all types of high-risk HPV. So therefore, that's why cervical cancer screening is still there. Having the vaccine doesn't stop cervical cancer screening being important. It still is very important. So signs to look out for, again, any of these that I mentioned now, go to your GP straight away. Don't wait. Bleeding between periods, bleeding after the menopause, changing your vaginal discharge, and pelvic pain. So if you notice any of these symptoms, you should go to your GP. The test, again, is designed to be as comfortable as possible, but if you have concerns, please do speak to your GP. Again, it's not a test to find cancer, it's a test to see if there's any cells that could become cancerous, basically. And it's really important for women's health. And, again, if you're trying to conceive, for example, it's important. And like I said, women aged between 25 to 64 who are registered with the GP, so please register if you're not, are invited every 3 years, okay? And then after that, once you're over the age of 49, up until the age of 64, you're invited every 5 years. And the whole point of this is they basically just try and collect some sample cells from the cervix. All right. Now, 9 in 10 women will go through the screening and have no changes, and 1 in 10 of them will basically need to go and have further investigation. Okay. So I think that it is probably better that I go on to cancer screening. Okay. breast cancer screening. So breast cancer screening, again, is one of the most common cancers in the UK. Around 150 cases are diagnosed every day. So it's a massive, massive cancer. And 76% of women survive for 10 years or more. And 23% of those cancers are, again, preventable. And things that are preventable, again, is your lifestyle factors, things like obesity, have a massive weight on the signs and symptoms. That means you should go to the GP straight away. If you find change in the shape, size or feel of your breast, if you feel that there's a new lump or thickening in your armpit, if you find that there's fluid leaking, especially if you're not pregnant or breastfeeding, if you see changes in its appearance, or like puckering, dimpling or a rash, and if you have pain, go to see your GP straight away. So many women complain that mammograms are painful, but actually for the vast majority it's just uncomfortable. It's basically a scan, an x-ray of both of your breasts basically, and the importance of that is to look to see if there's any changes again in the cells in there. And sometimes we can again catch things very early on, and there's certain conditions like DCIS that might be diagnosed, and it's really important for you just to know basically what's happening inside, what's happened to your cells. So basically you would go to a centre, you would have the mammogram, and you'd be given your results in about 2 weeks. You'd again, if there's need, then you would go for further assessment. Okay, you might perhaps need to have the mammogram repeated, for example, but we're looking at so out of 100 women, 96 have a normal result, and 4 of those are called back for more tests. Of those 4, 3 are found to be fine, and 1 has cancer. So 1 in 100 would be diagnosed. Okay, so you've got similar harms up to false positives or false negatives, false reassurance. So again, any symptoms, you go and see your GP. So yeah, I guess I need to start wrapping up now because it's nearly time to finish. So alhamdulillah, I think that it's been a very, very, very quick discussion on cancer screening, but I hope that you'll all agree that it's really important to help detect cancers early. I think that you'll hopefully agree now that it's really important to have the correct information, to talk to healthcare professionals, to talk to your loved ones, and really come to an individual decision on whether or not screening programs are right for you. And to really understand that, yes, it's all about people who do not have symptoms. So saying that I'm fine is not a reason to go and have your screening, and that the GPs are available and they are waiting, and there has been, unfortunately, due to COVID-19, a massive backlog. So please go and see your GPs. And I just want to end on one last story. That is, again, I was talking to someone when we were doing this in our mosques. Didn't have a clue about cancer screening because again their children hadn't told them about it. So I was like, no auntie, it's really important that you go and you have your mammogram and you see. So yes, this auntie went to have her mammogram. They did find changes in basically in the breast density, and they did diagnose her, but they diagnosed her with had treatment, and basically she's so thankful that she caught it early, that there was no need for invasive treatment. Like alhamdulillah, all she needed was radiotherapy, and yes, and she basically, the following year when I came back to the mosque and did it again, she was just shouting she was just saying to everyone, do it, listen, it's really important for our health, don't ignore it. Who knows what would happen to me if I hadn't have sought the this advice. Who knows what stage I would have been at, what kind of treatment I would have needed, or how it would have affected my family. And she was just so thankful, alhamdulillah. And this is what makes it all worthwhile, is when you hear those stories that it's actually helped people, that it has saved lives. It's humbling. So thank you so much. Like I said, any worrying symptoms, please go to see your GP, and please have this conversation about how important cancer screening is with your families. Jazakallah khair for your time, and I wish you all a blessed Ramadan.